In this video by deckplate we will understand the VA rating for hyperthyroidism, hypothyroidism, and hyperparathyroidism. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Understanding how the VA rates various endocrine disorders like hyperthyroidism, hypothyroidism, and hyperparathyroidism is essential for veterans seeking disability benefits. Here, we'll break down the specifics of each condition. Hyperthyroidism, diagnostic code 7900. Hyperthyroidism is a condition where the thyroid gland is overactive, producing excess thyroid hormones. This includes conditions like Graves' disease. For 6 months after the initial diagnosis, the condition is rated at 30%. Thereafter, the residuals of the disease or complications from medical treatment are rated under the appropriate diagnostic codes within the appropriate body system. If there is hyperthyroid cardiovascular or cardiac disease, it should be evaluated separately under diagnostic code 7008, hyperthyroid heart disease. Eye involvement due to Graves' disease, such as diplopia, impairment of central visual acuity, or other issues, should be evaluated under the most appropriate diagnostic codes in section 4.79. Hypothyroidism, diagnostic code 7903. Hypothyroidism is a condition where the thyroid gland is underactive, producing insufficient thyroid hormones. Hypothyroidism with myxedema, characterized by cold intolerance, muscular weakness, cardiovascular involvement like hypotension and bradycardia, and mental disturbances, is rated at 10%. This evaluation continues for 6 months beyond the date a physician has determined crisis stabilization. After this period, the residual effects are rated under the appropriate diagnostic codes within the relevant body systems. Hypothyroidism without myxedema is initially rated at 30%. This evaluation continues for 6 months after the initial diagnosis, after which the residuals are rated under the appropriate diagnostic codes. If eye involvement such as exophthalmos, corneal ulcers, blurred vision, or diplopia is present due to thyroid disease, it should be evaluated separately under the appropriate diagnostic codes in section 4.79. Hyperparathyroidism, diagnostic code 7904. Hyperparathyroidism is an overactivity of the parathyroid glands resulting in excessive production of parathyroid hormone, PTH, leading to high calcium levels in the blood. For 6 months following surgery, the condition is rated at 100%. After 6 months, the rating is based on residuals under the appropriate diagnostic codes within the relevant body system, determined by a VA examination. Hypercalcemia, indicated by at least one of the following: total calcium greater than 12 mg per deciliter, 3 to 3.5 millimoles per liter, ionized calcium greater than 5.6 mg per deciliter, 2 to 2.5 millimoles per liter, creatinine clearance less than 60 milliliters per minute, bone mineral density T-score less than 2.5 SD, below mean, at any site or previous fragility fracture, is rated at 60%. If surgical intervention is indicated, the 100% evaluation continues until the day of surgery. If surgery is not indicated, the 60% evaluation continues for 6 months after pharmacologic treatment begins. After 6 months, the rating is based on residuals under the appropriate diagnostic codes. Symptoms like fatigue, anorexia, nausea, or constipation, despite surgery or requiring continuous medication, are rated at 10%. Asymptomatic cases are rated at 0%. Chronic residuals following surgery or treatment, such as nephrolithiasis, decreased renal function, fractures, vision problems, and cardiovascular complications, are evaluated under the appropriate diagnostic codes. Hypoparathyroidism, diagnostic code 7905. Hypoparathyroidism is an underactivity of the parathyroid glands, leading to low levels of PTH and calcium in the blood. For 3 months after the initial diagnosis, the condition is rated at 100%. Thereafter, chronic residuals such as nephrolithiasis, cataracts, decreased renal function, and congestive heart failure are evaluated under the appropriate diagnostic codes. Thank you for watching this video. Please don't forget to subscribe and like our videos.